It's recorded.
Hey, everybody. I'd like to call the meeting to order of the COVID Response Task Force Blue Ribbon Committee. Since some people are here today that weren't able to be at the first meeting, I thought we would go around and do some real quick introductions. I will start. I'm Kathy Beebe. I'm the Executive Director of Haven, which is Domestic Violence and Sexual Assault Agency, and live here in Portsmouth.
Hi, I'm Linda Bralette. I'm a retired Portsmouth teacher.
I'm Abby Frank. I'm the speech-language pathologist at Little Harbor School.
Hi, everybody. I'm Whitney Brown. I'm the manager of Safe Harbor Recovery Center, and I'm also a resident of Portsmouth.
I am Nancy Brown. I am a retired teacher, and I'm involved in a number of different things, volunteering at school, working at Crossroads, all kinds of stuff. Staying involved and active in community. Absolutely.
Janet Lotch, CEO for Greater Seacoast Community Health.
Hi everyone, my name is Tanya Marino. I'm a program director at Gather, New Hampshire.
Molly Wilson, I'm an occupational therapist in town, and I'm a parent of 2 elementary school students.
Mimi Wheeler, I'm the executive director of the Chase Home.
Hi, I'm Karen Conard, city manager, serving in an ex officio capacity, which means I get to attend, but not weigh in the same way. And I'll be the resource that helps provide city staff to this group.
I'm Andrea Ardito. I'm a former school teacher, and I own Nest in Portsmouth. I live in Portsmouth.
I'm Will Arvell. I'm the executive director of Crossroads House.
And Will is also the co-chair of the committee. At the last meeting, did the folks that weren't at the last meeting get the information on the right to know and the public meetings?
I will make sure they did. I don't know that. They should have come from me. So we'll make sure that gets disseminated via email. And you know what, Kathy, the thing that's missing from the agenda is approval of the minutes from last meeting.
Great.
But not to lose sight of your request, I'll make sure that they all get those.
Do you want to give the same kind of overview that you were able to give last time, just about what that means in terms of?
That we're a public meeting. Let's see if I can remember. So we're a public body, and as such, we need to always meet with an in-person quorum. So if you got that sense from my email, that's what that's about. If there's an ability for you to meet but not be in person and you have to be remote, just let the chairs know, and Kathy and Will serve as the chairs. And as long as they can manage having an in-person quorum of at least 8 people here, that will work for the group. And in things like email, this group should not have a conversation that, I've got an attorney in the room and I'm probably butchering this. But as a public body, we behave differently, and we should not have policy or discussions beyond things like time and place of a meeting with a group, because that constitutes a meeting, and we have to be sensitive to conversations that we have inside and outside of this room or the meeting confines. So beyond that, I will be sure to email out the brochure on Right to Know, and because as you are all now volunteering on a public body, the Right to Know rules apply to you now. So we'll send that out.
Thank you.
Thanks.
Okay, so hopefully people had a chance to look at the meeting minutes from the last meeting. Is there a motion to approve those?
I make that motion.
Oh, we have 2. Yeah.
I'll second.
All right, Janet and Will, all in favor?
Aye.
Aye. Great.
Somebody serving as secretary?
Yes, Janet.
I'm secretary, yes. That's why I'm diligent.
Great. So I think up next we'll hear from Jane Farini with an update on the ARPA eligible use.
While Jane is coming to join us, some of you were kind enough to give me updated information on your contact information and what your affiliation might be and some of your background. This one does not appear to be the most updated, so I will be sure to get everyone the most updated. And if you haven't had a chance to review this or make your changes to your own information, feel free to email me that. Thanks. And I've asked Assistant City Attorney Jane Farini, who is our in-house guru expert on ARPA, to join us and give you a condensed version of the presentation she's given to work sessions and council in the past about the American Rescue Plan Act, or ARPA. So thank you, Jane.
Thank you.
So I have a presentation. Hopefully we can get that up and I can
It's me. Hold on.
chat along with it.
Faster.
So most of you are obviously familiar with the ARPA, American Rescue Plan Act, and the funds that were provided to basically every city and town in the country to respond to COVID. And the intent and purpose of the funds, I think, basically, I like to describe it as to make communities whole, you know, caused by the damage, frankly, that COVID caused to all of our communities and all of our citizens. So when you're thinking of expending these funds, I think you always want to have that in your mind. What's the purpose of this money? Who are we trying to help? And what we're spending, does that actually address, you know, the problems and the issues that were caused by COVID? So if we could go to the next slide. So here are some of the stated purposes in various CLEs and Treasury publications that have evolved over time. Obviously, stop the virus, right? That was really the first and imminent, and still is, a primary concern. So Kim is going to, I'm sure, explain more about what kinds of things address that. But that certainly is one of the purposes of these funds, to replace lost public sector revenue and to, you know, support public services. I'll go down and give some very specific examples of what that looks like, but that was one of the overarching purposes of these funds. And then support households and businesses, you know, struggling with the impact. And that also is institutional and individual. So it runs the gamut from, you know, small businesses, nonprofits, and individuals. It's a really one of the most broadly described acts historically. It really has, and it's evolving each time we get guidance documents. You know, there's more information from Treasury as to what we can do with this money. And then one of the lenses that we need to look at expenditure of COVID funds is to certain populations were disproportionately affected by COVID, and that runs through all of the Act and all of the guidance documents. So that's particularly important to remember. And now we're forward-looking, right? We're trying to spend money on things that hopefully will address our ongoing COVID, you know, issues, but also I think looking forward to preventing further breaches in our wall, so to speak, caused by COVID. So anything that's going to shore up some of our programs and institutions and support long-term growth. Next slide, please. So there are 4 broad categories of funding, and those fundings have particular criteria attached to them and reporting criteria and standards. So the first and the biggest is the public sector revenue loss. When the Act first came out, it was determined that you had to do this mathematical formula, truly look at your numbers, look at, you know, your revenue, do a very complicated math problem, which I could not begin to explain. That's why I have our Andrew in our counting to do that number. But realizing that every city and town had to try to do this, Treasury made a very good amendment or change between the interim rules and the final rules and said, if you're a city or a town, you can declare up to $10 million as lost revenue. Now, if you're awarded $5 million, you certainly can't declare 10. You can only declare up to what you've been awarded, but rather than do this challenging calculation, that in April of this year, they came out with the fact that you can just determine your one-time election of that 10 million, which the city of Portsmouth did. So we received what, about 12.6
12.88.
12.8. So 10 of that is in the category 1 category of lost revenue, okay? The second is public health negative economic impact. That's what I'm going to explain to most of you. That's really, I think, something that you're all here, given your various backgrounds, you're intimately familiar with these impacts of COVID. The third was premium pay, and the fourth is water, sewer, and broadband. And I have some dates up there, you know, when you could use the funds and how long you have to expend and obligate those funds. So we have several years to do that. We need to obligate them by December 31st of 2024 and perform on December 31st, 2026. And if you don't spend it, you have to send it back. Next slide.
I'll mention that in case you're scribbling, we will make this presentation available to all of you via email. And the good news is, and the difference with Portsmouth being the size city that it is we already have the funding in hand.
Yes.
It's not something we need to seek through the state. That's a big advantage as well.
We were one of the few metro cities of a particular size that we got our money straight from Treasury, as opposed to most of the communities have to go through the state of New Hampshire, and it's a bit of a different process by which to receive funds.
Could you explain why that happened or why that took place?
Particular size of cities, and I believe that originally we had the way they analyzed qualified census tracts back in the day. You got certain weighted in the formula to figure out how much money you're going to get, even though the composition of our city has changed significantly since that evaluation was done. I think that's why we got as much as we did, and I think it's based on that kind of a formula. Mostly size. Big cities are determined X, and middle cities are determined Y, and then cities and towns are determined to be different. So this is the public sector revenue loss. I've explained that pretty much, and you can expend it on government services. So anything a government can do, that can be lumped into the public sector revenue loss. And you can see a list there, you know, schools, hospital, roads, health, environment, police, fire, equipment, anything that takes the run of government. Next slide. And then this is the other category that is much more nuanced, and there's lots of examples of the public health response. So this is the second category, and this is the one where you actually need to attribute, you know, some effect by COVID. Whereas obviously revenue loss, you know, you don't have to buy an ambulance because of COVID. You know, you would have done that as a part of your government services, so you don't have to link, so to speak, or view it through the lens of COVID's impact. So anything that's in the guidance is not an exclusive list. I think that's important to remember, that if there are certain things that are ideas or ways in which we think we can address COVID that might not fit perfectly into one of these categories, there is a possibility to still use money for COVID. And I have since learned that Treasury does not mind getting direct questions. So, you know, question before you act, so to speak. I think there was a reluctance at first. Are we going to get in trouble if we ask a question, or we're not sure of something? But that doesn't seem to be the case, and we have other resources as well. So if there's something that comes up and it doesn't fit neatly into a category, it won't necessarily be prohibited. And these are, you know, the nuts and bolts of the COVID response, you know, vaccines, you know, contract tracing, quarantine, PPE purchases, and then, like I said before, improve support and outreach and communication with vulnerable populations, and access to health services. You know, this is something that we all saw during the pandemic. It was a need that's being addressed by these funds. One of the interesting things that the final rules did is you can actually make capital investments for public facilities to meet operation needs. So that was very interesting as well. preventing and responding to violence was something that was expanded between the original interim rules and the final rules. Some of our communities, the disadvantaged communities, there was an increase in violence, and so funds can be used to respond to violence, and staff who deal directly with COVID-related issues. Next slide. And there are various assumptions made for certain types of funds. So if you were a resident in a qualified census tract, or you were a nonprofit, or you were a business in a qualified census tract, you could, it's almost like automatically spend the money on, you know, for these types of uses for impact on public health. These are, we do not have a qualified census tract anymore in the city of Portsmouth. So there's two types of households. One is the disproportionately impacted households, which are folks that live in a qualified census tract, particular income qualifying folks, and households that qualify for other federal programs and benefits. So you can spend for these types of things for those folks that are disproportionately impacted. So you have to identify your community, you have to expend the types of funds, and you can do different things with those funds if you're spending on needs of that particular community. So this is very broad. You can help healthcare workers, transportation costs, medical equipment, housing vouchers, relocation to neighbors with higher economic opportunities, physically improve vacant properties. It's extremely broad. The other income qualifying category is impacted households. It's the income qualifying level is not the same as the qualified census tract, but again, you know, folks who've experienced housing insecurity. And then there are these other types of monies that you can spend: health insurance coverage, financial services, affordable housing development, childcare, early learning. And you may identify yet a third population or group if you've done your due diligence and you've made an assessment and you can support that there is a particular population that doesn't fit these other two definitions. If you have supporting information, you can spend, you know, use the monies for assisting those particular groups. Next slide. And it's not just people. It's businesses and nonprofits and particular industries that these monies can be used for. So small business and nonprofits that had a decrease in revenue or a sort of exponential increase in costs as a result of COVID, you can do things like give loans and grants, technical assistance, and small business planning for businesses. And then there are disproportionately impacted small business, again, in a qualified census tract, which we don't have here in Portsmouth. But the other interesting concept is you can provide money to a particular impacted industries. We all saw with hospitality, travel, and tourism. Some of the guidance documents that have come since the original act has come out encourage that if you're going to provide money to an industry, you want to try to do it broadly. You know, you don't want to just pick your favorite restaurant. You know what I mean? You want to make sure that if you're expending on this sort of industry impacted, that you do so in kind of a equal way. Next slide. And so one of the aspects was to make governments whole again and to get staffing levels back up. And so public sector employment, a lot of folks had furloughs. We were fortunate that we did not. But there were monies, these monies could be used to cover payroll, particularly for our public health and our human services staff. But you know, again, these are things that are allowed under that particular category of the response to shoring up our public sector capacity. Next slide. And One of the things that was again expanded and in April with the final rules is the issue of what's a capital expenditure. It was uncertain when the original rules came out. Can you do brick and mortar? You know, what can you spend? And so they clarified that for this whole section, you can build stuff, basically, and buy stuff. But you have to support that with a particular documentation, and it has to have a direct relationship to the programs and services, and you need to make sure that you've quantified it and documented it. And if you're building something that's most economically, not conservative, but it's targeted to the problem that you're trying to fix. So in other words, I have examples of what you can't do. You can't, you know, build a new jail because you might see an increase in crime in your neighborhood. That just, it doesn't connect, right? That's a little bit beyond the scope of that. Or build a convention center or a stadium just to increase, you know, tourism, to attract tourism. So, but it is very interesting that you can, you know, hospitals and other types of capital improvements can be spent now with these funds. Next slide. And the third category was essential workers. So this is a category where folks who are on the front line, so to speak, you can actually fund money to those folks. And that includes a broad list. People that work in hospitals, nursing homes, people who grow food, who sell food, janitors, warehouse workers, truck drivers, childcare workers, school and social service folks, and the public health folks. So that's very interesting that you can use this money to help with folks who are in the front line and have their pay, you know, either supplemented if they didn't get paid or augmented if they need more money. Next slide. And then water and sewer infrastructure. Particular projects that are eligible for Clean Water State Revolving Fund or Drinking Water State Revolving Fund. You can use your funds for those types of projects. And these are, you know, pretty much what they sound like, you know, wastewater treatment plants and stormwater management, all of that, and then water quality. So obviously, infrastructure is very important. We want to make sure people have healthy, clean water, and those kinds of funds that are eligible under those definitions are projects that you can use this fourth category of funding. Next, yep, and then broadband. So that was another category that you could use. I think we're pretty well wired up here in Portsmouth, but certainly you can imagine in some communities it was devastating, their lack of broadband, and still is, quite frankly. And so this was a very important area that many communities needed to address because of the impacts of COVID. Next slide. What you can't do. Okay, ineligible uses, premium pay for teleworkers, deposits into pension funds, debt service, rainy day funds, financial reserves, legal settlements, infrastructure not directly related or described in the rules, and federal matching requirements. Next slide. And then, of course, most of you are very well aware of federal funds have federal strings, and so you need to do what you are required to do under the reporting requirements to Treasury. We have to file quarterly reports on how we're expending these funds. The lost revenue category, that category one I spoke with earlier, that doesn't require as much documentation when you are filing with Treasury because it's what you would have spent in your normal operations. But everything else I've talked about requires particularly detailed reporting on the project itself, the ongoing status of the project. Certain data is required depending upon how you are expending those funds. certain data is required if you give money to a sub-recipient. So that would be an entity that would be performing whatever service that you've identified that is important. So not only would you have to make sure you're complying with reporting and federal rules and regulations on expenditure of funds, but that the subrecipient would also be complying. And that, again, is a more complex and robust reporting that's required of the city. We have to comply with the awards and conditions associated with particular these ARPA monies, and we need to make sure that we have information that connects our objectives to what we've expended. And I think that's really the most important thing as far as data, you know.
Jane, I have a question. Just to be clear that in terms of compliance, this body is not going to be responsible for that.
No, not at all. Nope.
Good point.
That's an excellent question. So basically, that's, you know, a 10-minute summary of a 400-page.
Jen, I have a question. Does the expenditure, do we have the discretion to expend it as we see fit per these guidelines, or does it need to be actually approved first?
That's a great question. No, there's no pre-approval at all. So we do our best to fit it into a category and provide that documentation and that explanation as to why we think it fits in the category. But no, there's a lot of other types of federal funds that came out earlier. There was some of this pre-approval, and you would submit your proposal, particularly in education, I'm sure, right, through the state. You know, you've got your all your various different funds and CARES Act funds. There were some grants that you would get pre-approval for, but this is not it. It is wide open.
Let me jump in to say that anything that we've previously expended or appropriated funds on has to go through a prescribed public hearing process. That's a function of spending any ARPA dollars, and I can spend a minute on that when it's appropriate. But every time we've asked the City Council to expend monies, we have to hold a public hearing, explain what we're trying to do and how it fits with ARPA guidelines. And so things that we as a group tee up would follow that track in the same way that 1, 2, 3 sets of other appropriations have to date.
Yeah, that transparency is critical, and it's woven into the whole act and the language of the act. And so we're at a public meeting, we're talking about this, and public could attend, and any expenditures that we do make go through the council and then are reported. So it's part of the process of and requirement of the funds.
And with regards to the funds, if the task force kind of in the course of this decides that some of these funds would be better allocated over as multi-year grants, does that money have to actually physically be distributed by December 24th, or can it be, say, allocated but not physically, like,
Everything
leave the
has to be
coffers?
physically
It has to be
expended by the
physically gone.
calendar year end of 2026.
Oh, okay,
Mm-hmm.
all right.
You could obligate it before 2024, but expend before 2026.
Okay, so you could gift over, say, 3 years or whatever.
Yes, and the act was written that way, I think, contemplating the fact that different needs will arise and over the course of the years.
Karen, I have a question for you, because my understanding was that we would come up with recommendations based on public hearings and so forth, and that would ultimately go to the city council for their discretion.
Correct,
basically.
that's correct, yep.
Okay.
In the same way that other considerations have been brought to the city council by the staff so far. So maybe it's a good time for me to explain that a small portion of ARPA funds were expended in the FY22 city budget to address HVAC and storm water improvements. And then there were 2 tranches of money that had public hearings that really allowed for items that are on our capital improvement plan, items in our rolling stock, items that are critical to our IT infrastructure, and as a good segue to Kim, a small portion to tee up the community public health assessment. So that's where we get to the total of funds expended, appropriated, I should say appropriated, not all expended, of $7.4 million, which leaves $5.467 to be distributed, to be obligated and expended.
And 2.8 of that is not lost revenue.
Correct. That is a good point.
Of the 5.4.
Correct.
But at the last meeting, there was a conversation about this 5.4 million, that number could go down, right?
That number could very likely go down, that this group would be focused on making recommendations that are brought as a set of priorities from this group. There are other groups vying for the attention of these limited funds. There's a whole list of city infrastructure needs that exists and gets refined. There is a request, for example, of the Arts and Nonprofit Advisory Group that they are seeking as much as $480,000 toward to help offset the losses in the arts and nonprofit industry. So, as I mentioned at the last meeting, this money is already spent a bunch of times over. So our job here is to help educate the council, to help them understand the priorities and your specific recommendations, because you all see them in a way that they don't, and they appreciate your view and your expertise working as a collective.
And are decisions being made on a rolling basis as you get these requests from various groups or recommendations?
It has evolved into a bit of that. There have been times at various stages of the two budgeting processes over which we've had these funds available where it's been sort of an obvious, how does ARPA impact what we're talking about? Kim had the foresight to say, to raise her hand and say, it's time to do a public health needs assessment. I need that money right now. And that was a one-off, if you will, for which we had a hearing. But it's rolling in nature, and I think the council wants to see a holistic approach for how to spend what remains of the funds.
Thank you.
You may have addressed this at the first meeting.
We're going to make you speak into the microphone.
Oh, sorry.
That's okay.
A number of us work for nonprofits that I think would be wanting to go for some of this money.
Right.
And I'm wondering if that's considered a conflict of interest, or if that's been addressed already.
That's a good question.
That is a good question. Obviously, the application would be as a sub-recipient. I suppose when it comes to actually vote on your particular proposal, that's probably something for you to consider if that actual vote's a conflict. But if the group as a whole made the recommendation, I don't think that would be a conflict. But
Right, and this group is advisory in nature to the group
Advisory.
that will ultimately make the decision.
Right, so you won't be making the decision, you'll just be making the decision of what to propose to the council.
But it's a great question, because I'm sure that will apply to more
A lot
folks.
of us here.
Just another question, to follow up on Kathy's question or comments around the rolling process. If we do come across some emergency need that we, as a body say that this is something worthy of attention right away, could we make a recommendation on a rolling basis? Or
I certainly think that's an option, and I think it would be incumbent upon this group to determine that and to perhaps bring it to Councilor Bagley, whose idea it was to form this committee, and have him bring forth such a request. Wouldn't want to rule it in or out.
Are there any other questions for Jane?
Jane doesn't go far, so if we need Jane as a resource,
Thank you, that was great.
ask.
I'm around. Thank you so much. Good luck.
So, I have one question. So we'll have time to really look through this. You just gave us like a little overview of each section.
Sure.
Between now and the next time we meet, hopefully we'll get to study this, and I'm assuming we'll have some questions or
Sure,
some
and that-
things we want to.
And we'll always be a resource, and when I get that presentation out to you all, I'm sure it will jog additional questions.
Yes.
I can send two documents. I can send the PowerPoint, and if you are interested, it's an overview. It's from the Treasury, and it basically goes into a little more depth on the 4 areas, and I can attach that along
I
with
think
my
that's good.
PowerPoint. And then this is, you don't want to read the 400-page.
I think Nancy does.
Maybe you do. That's okay.
We'll make Nancy our in-house
I want to
expert.
read this first.
Right,
That's more
but
basic.
this will really drill down and give you enough to springboard, and then you can go to the specific questions of the act if you have it. But this, I think, will be very helpful.
Okay.
Great. Thank you, Jane.
Thank you.
Thank you, Jane.
Thanks.
Next, we'll hear from Kim McNamara, Health Officer.
Welcome, Kim.
Good afternoon. Do you have my slides, Karen?
You never know with me. Hold on.
It says Recover Task Force because I can't type. There you go.
It's okay.
Thank you.
Good.
Well, first, I'd like to say thank you to the city manager and the city council for supporting this really important group and effort. Many of you have experienced firsthand the disproportionate effects on some of our most vulnerable citizens, and I deeply appreciate the work that you do. So thank you for being here, thank you for your time, and I certainly hope it's not a conflict of interest, because this is a good group of people to be discussing this issue. Thank you. So I'd like to start with a definition of public health, of which there are many variations. But public health is a collective art and science performed by all of you and numerous others that we're so fortunate to have in Portsmouth working for the collective quality of life in Portsmouth. One of the most important definitions is the first line in the preamble of the Constitution to the World Health Organization, which states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We often think about the science of health, particularly through COVID and all, but we don't always consider that mental health and social well-being is a very important part of our overall community health. The second line of that Constitution says, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. And I would add to that, or different abilities. Next slide, please. So this is the opening statement of an RFP that was released yesterday. City of Portsmouth, I'll read mine because I can't see that one. City of Portsmouth is requesting proposals for a community health profile and needs assessment with recommendations for the development of a community health improvement plan. So we're asking for two things, and the City Council has approved the expenditure of these funds for these purposes. The community health profile is going to give us a picture of the overall health of the community, of just a broad picture based on demographics and leading health indicators. We're also asking for a community needs assessment, and that's going to help us pinpoint gaps in services and unmet needs of the community, particularly with the most vulnerable groups, those who have been most disproportionately disrupted by COVID. There are some significant challenges. I'm still on the other slide, Karen, sorry.
All right.
There are some significant challenges in undertaking a community health profile in New Hampshire, as some of you probably have tried to do this and have learned, but many of the databases that we rely on, such as the cancer registry, they can be very slow to access, and they can be a few years behind in reporting. So we're asking for the best available data to be used, but also that the data sources be clearly documented so that we can do future profiles and needs assessments and sort of know that we're comparing apples to apples and know where we stand. We can see progress that way, and we can also see decline that way if we're really careful about that. So I'm really cautious not to overpromise and underdeliver, which is a little bit what this feels like. But I'm certain that going through this process, which will take a lot of stakeholder input, including from many people at this table, probably everybody at this table, it'll provide us really good information about the overall health status of our community. The last health profile was completed in July of 2007 that the city had any sponsorship of, and that was funded through a public health grant from the state. So it's long overdue. Next slide, please. So both the community health profile and the community health needs assessment will be available to the city council and associated committees such as this one, organizations, stakeholders, and grant writers, and with the goal of increasing community health through collective impact, which is what I think exactly is the point of this group. Sorry, I already told you that. So the Community Health Needs Assessment will serve as the foundation for a future development of the City of Portsmouth Health Improvement Plan, which will identify and prioritize recommendations for investments and interventions to improve the city's health, equity, wellness, and resilience. So that brings me to my first ask of this group already. Here is the RFP timeline, and the RFP was specifically written to be so that the proposals or the profile and the needs assessment is pretty much done before this group stops meeting, because it's very important that the city council have that information and that you as a group have that information going forward to make any recommendations. So I would ask that if you agree with that, one of the recommendations you could make to the city council is that once this process we're undertaking now is completed, that the next step be a community health improvement plan. Next slide, please.
Sorry. There we go.
That's all right. So Jane brilliantly explained the ARPA monies, but there is one thing that I want to make clear. To my knowledge, none of the ARPA funds have been spent on public health services in Portsmouth. We worked long, hard hours for many months, but we did that using state resources, the mobile vaccination van, or state funds which paid some of our counterparts. The health department does not get overtime. We did not receive ARPA funds, and so I just want to be clear that so far on public health needs, I don't believe any has been spent, not for our department anyhow.
Just explain that a little bit more. That means the funds that are available, you already did apply for some of them.
No, I'm saying exactly so I'm saying something different than what I think you are thinking of.
Interpreting.
It was mentioned by Jane that some of these could have been used for public health workforce and paying certain public health workers more money. That didn't happen. We haven't touched any of these monies. We haven't asked for any of that.
You haven't asked for
We
it.
did ask for monies to fund this community health profile and needs assessment, which the city manager graciously brought to city council and they approved. So that's how we were able to.
So that's been approved?
Yeah,
Okay.
that's how we were able to put the RFP out yesterday and start the work on that. So what I want to point out here, as Jane already went over with you, but one of the main uses of ARPA funds is addressing systemic public health and economic challenges that have contributed to the unequal impact of the pandemic on certain populations. We know that we have many disproportionately affected populations in Portsmouth, and you probably know that better than I do. We know that we have child care and youth crisis intervention programs that are running at half capacity because there's not a workforce left to allow them to meet the required ratios for state licensing and funding. This affects a number of local families as well. They can't return to their jobs without safe and consistent child care. We know we have senior and disabled residents that lost their home health care and social services throughout COVID, and we've intervened with some that were in very dire situations and had been for months. We know we have intellectually and developmentally disabled residents that need daily instruction and reinforcement to maintain skills that have taken them years to master, and they've been set back severely and are going to have to regain those skills. We have children and youth that have lost instruction, inclusion, and rewarding accomplishments, such as learning an instrument, developing their artistic talents or performing arts, sports and physical fitness opportunities, and life-saving skills such as swim lessons. I'm sure many of you in your field of expertise could probably add greatly to that list. The need assessment should help us to gather in a comprehensive manner those different parts of the community health status and give us a clearer picture. When ARPA funds were first announced, the health department started gathering some information from local nonprofits that serve these vulnerable populations. And to Karen's point, as of yesterday, the health department has been notified of needs in excess of $2.6 million from many local nonprofits, but there's also many other local human service organization nonprofits that we haven't heard from. In looking at the commonalities between what people have submitted, there are a lot of overlapping need, and I think that a comprehensive review of what is needed and then some good planning, and you could probably get the outcomes people need for much more cost effectively than every nonprofit individually putting in. You know, transportation, for example, is a big theme that has come, you know, that we even have available services that people can't access because people can't get to them. So I don't know how much into those discussions this group is going to get, but I think that a coordinated look at those things is a very important thing. In addition,
I was just going to ask you a question about, so this survey is going to go out to every resident of Portsmouth, or how's
you
that?
mean the community health profile?
Yes.
No, but there are various legs of it, and it would probably take quite a bit of time to describe it, but the things that will happen is there will be stakeholder meetings, there will be interviews with people that play prominent roles. We do want to hear from actually the people receiving services or needing services, so we don't want it to be completely agency-based, you know, what they tell us the need is. We do want to hear like some from parents groups of different individuals about that.
I've just put that slide back up just to give a sense of what Kim is talking about.
Yes, so this is the outline for how they're going to respond to us and tell us what's going to be done. So we're going to have the stakeholder meetings to begin within 30 days of when we get a proposal finalized. Within 60 days, we're hoping that they will submit this community health profile needs assessment to the city health department so that we can begin looking at it. We've asked for monthly feedback, so if they look at a segment of data and they say, listen, we've completed the information we're concerned about your developmentally disabled residents, they can submit that to us prior to the final report so that we can then start maybe doing some work on that. Or so it'll be coming in bits and pieces, but the final profile and needs assessment, we're asking for them to give back to us in 90 days of when the proposal or the contract starts. That's a very quick turnaround, but we've been very pleased to see many quite capable agencies that said they were interested in receiving the RFP to see what they could do. And we can break it down. We can do a community health profile if one agency has those skills a little bit more than the needs assessment. The needs assessment we really want to be local, and we want it to be focused on what we've already seen and we already kind of know, and then hard data behind it. That's, you know, that's going to be a little bit of art because we don't have great data in some arenas. But
How did you distribute the RFP? Did you identify local nonprofits, or how did it go out through the city?
The RFP is for public health agencies that know how to do these profiles. And so what we did was we asked people on our former Mayor's Blue Ribbon Committee for Public Health. They have some very good connections. We talked to UNH, we talked to the Manchester Health Department, the Nashua Health Department. We talked to some people in Boston and Dartmouth. And we just gathered names of people who were doing this work and people who came with recommendations. And for every name that we received, we sent out the RFP.
Okay.
So,
Move forward.
I'm sorry.
I went backward on you.
No, that's fine. We can stay right here. Because in addition to the 2.6 million that people have already identified as needs, the health department has asked for $3 million of ARPA funds to be set aside until the completion of this community health profile and needs assessment, and then decide on that. I mean, this is one of 4 uses for this, but it's really important to understand that public health needs almost never get funding like this. The last infusion of federal dollars of any real magnitude that we saw, I believe, was after 9/11, and that's kind of typical. So we do have a variety of needs, but this might be an opportunity to really look at systemic public health issues here. And so that's the second ask I have of this group, is that I would ask you to make public health a priority. I realize that I'm beating the public health drum, but that's my job, but it's also just what's fair. And so I would like it if this group would consider the recommendation that public health be a priority for these funds. That's the next slide, please. And that is my email address. I want to thank you very much for this opportunity to be here and to speak to you. And any questions or comments or anything that I can do for this group, please email me, and I'm happy to do so. I will be out or away for a couple of weeks, but when I get back, I'm quite eager to help if I can.
I just have a quick question. Greater Seacoast, or Greater Portsmouth, is that just Portsmouth? Is that what you're saying? Or
So
is it
the
other
original,
communities? Yes.
the 2007 profile was Greater Portsmouth, but that's a great question because we might need to go to that because there just isn't great data. Or if your numbers are too small, you can't report things if they're identifiable. But if we say, listen, Rockingham County has this public health issue, and we do have Portsmouth residents that fit into that category. So I assume that there's going to be some data that comes in that cannot be broken out from the county level.
So it's data-driven, not by, I thought there might be other communities.
Well, this is as Portsmouth-specific as possible because Portsmouth is paying for it.
Thank you.
It makes sense to me that having you come back and as this needs assessment begins to get out into the community and you start to see data, to your point about us at least having a conversation about making public health a priority, that you come back and report out what you're seeing, because I think ultimately that's going to help us come to some conclusions. So your input will be really critical.
Thank you.
Thank you.
So we already have a master list of issues and populations that we want these applicants to look at, and it's fairly comprehensive, but I expect that you all and people that are on the community care team, which we have an extensive contact list for, we will be asking them, like, are there any groups that we've missed in this? Are there any types of data that you're looking for? Are there any public health issues that may not be tied to a specific group, such as gun violence or eating disorders or whatever, that you would like to see as part of this? We're going to ask for everything that we can, and we'll see what we can afford and what we get back for answers.
All right. Any other questions?
Thank you, Kim.
Thanks.
Thank you. Thank you so much. Yeah.
So is this meeting supposed to stop at 1?
I think the intent is to try to manage people's time as effectively as possible and give people a sense that if we can stick to an hour, yep.
Okay. So given that, we are a little behind on our agenda, so, and we need time for the public comments.
So far, we have no members of the public. If that changes, I'll let you know.
Oh, okay, great. So what we were hoping to do was kind of look at next steps. Today was really about getting some information about the use of the funds and the public health survey that's being done, and to kind of brainstorm what might be helpful for other people we might need to hear from, or other information that this group could have before we kind of dive into the conversations and the strategy around what are those things that are there and pressing and needs of the community that we're trying to address. So we also, at the last meeting, set this meeting and one in 2 weeks from now. And I don't know if the plan was to revisit if that's going to continue to be the schedule, or I don't know if you remember. I'm not remembering.
I think we had less critical mass at the last meeting, so the idea was if we have more committee members or task force members here,
okay,
you could weigh in on the, do you like every 2 weeks? Do you like Tuesdays at noon? Things like that.
Okay. So maybe in our short amount of time left, we can talk about what makes sense for meeting times, and then maybe some ideas for what we want to see at the meeting that's scheduled in 2 weeks.
Kathy, you mentioned possibly breaking into subcommittees that could meet outside of these meetings. I think a lot of this seems to be pretty time sensitive, especially if we're perhaps competing for funds and we want a lot of these funds to stay within this public health sector. So perhaps like subcommittees might be effective way.
That was something that was brought up at the last meeting, and I think we wanted to get to the point where we were trying to figure out kind of what our focus areas were, and if we narrowed that down to then see if there was more work that could be more effective. How does that work, Karen, if there's subcommittees for public?
That's a good question. And the subcommittees can work as a working group and bring back what they discussed to this group.
Okay. So it just needs to be noted that there are subcommittees and that they report back out?
I think to be super safe, the subcommittee would never want to be more than a quorum of the entire body. So if a subcommittee is a couple people, 2, 3, that would never be considered as tripping a quorum.
Okay.
So if we keep the subcommittee small and they act as a working group that reports back to the public body, that is safe from a right to know on public records.
Okay. But I do agree that we're probably going to get to that point because of our timeline and all of the different pieces.
I think what we should also mention is, for those who weren't here last time, that there will be a report to the council in December to talk about the progress the group has made and any recommendations they'd like to make at that time. And I think baked into that would be consideration of whether the group should continue on or sunset, depending on how the work of the group is going.
Okay.
What date in September?
Yeah.
I don't know. There are 2 council meetings, one on the 5th of December and one on the 19th.
Oh, December. Okay, I thought you
Right.
said September.
Oh, gosh. Right? Let's meet every day.
I have a couple of questions, just learning about, or trying to kind of understand everything that we might participate in, or what we should be doing, or making, like, I would like to learn more about what Kim has to say about public health issues. That's my background. So I'm just being open about that. So do we each choose or work together? I mean, what are you asking, what are we supposed to be doing? Besides learning all about this stuff, then making recommendations.
Yeah, well, and I think that that's the conversation I think we have to have. And our question was, do we need more information before we dive into that conversation of, like, one of the things that, talking about kind of the overlapping needs, my takeaway from the last meeting was that there's these overlapping needs, and if we can look at some of those and come up with some ideas that will have a greater impact across the board, that's kind of what we're tasked with, is figuring out those. So those could be looking at all the different things, whether we focus on, seniors, children, mental health, transportation, all the different pieces. Given that we have the wealth of knowledge and information in this room about what we're all seeing among the folks that we're in contact with.
The other thing to keep in mind is that we will, in addition to all of the expertise in this room, I mean, we're being asked to have public hearings. And at those public hearings, we will hear from folks who have their take on where they would like to see this money spent, which is great to see that. Karen, I think I would benefit from having somebody like Sean Clancy come and do a little bit of report out on economic development. Because to me, in my mind, all of this is tied together. Public health, you need to have a healthy community, and part of that is employment, jobs, and all that goes, business development and so forth. And I really think that certainly I would benefit from some sort of a presentation on where the city is related to its success or challenges with economic development, and how that plays a part into public health.
Happy to make that happen.
And then I think I don't know who else we would want to see come and talk to us.
I mean, I don't know if people have any, were you going to say something?
I'm interested in who's on the community care team that Kim mentioned. Is that a public body?
I don't know. I can ask her to provide that to us.
Yeah.
Community care team.
I think that's for complex patients that we share amongst each other to coordinate the care. That's my understanding. That's what we do.
Yeah, so
Okay.
there's multiple agencies that are a
Yeah.
part of that.
The CCT meetings?
Yeah.
Yeah.
Oh, okay.
CCT meetings.
Great. Okay.
Are there other folks that people feel like we need to get more information from, or do we want to, Will mentioned Sean Clancy, do we want to see if Sean can join us at one of our meetings, but then also kind of, are we ready to dive right in looking at where we want to go?
Have we decided of those 4 groups that we're just going to focus on public health?
No, we haven't decided.
The charge is broad. Sorry, Will, to cut you off, but I'm reading from the email that essentially paraphrases the vote of the council, and the idea would be for this group to evaluate challenges and identify low-cost, high-impact recovery solutions that could utilize ARPA monies. So the idea is, what does that mean to this group? Really?
Yeah.
So should we maybe come prepared to what does it mean to?
That's not a bad idea.
As a group, each of us
Yep.
individually as to what we see in the field?
I'll recirculate to the group the mission and the charge, that little paragraph. But Kelly Barnaby sent it to most of you. I know we have a new email for Andrea, and I know we didn't include Nancy in that first go-around because you were a late appointment. So.
Oh, you mean talking with each other?
Yeah, we'll recirculate the mission charge so
Oh.
that when you're having that conversation, you have the language in front of you.
Can I just caution us that I know we all have our specific interests, and that's great, but I think that a body like this really requires us to think much more globally, beyond our own immediate organizations and needs. Because ultimately, for me, it is about how do we identify the big picture issue or issues that really need to be addressed with this bucket of money as much as possible in as efficient and effective a way as possible. So that's obviously going to have an impact. I mean, I think if we think about it that way, it will have an impact on probably all of our organizations in some way or other.
Yeah, and when Janet brought up, coming to the table with our thoughts, I was really thinking of it as those overlapping needs. What are we seeing out there that are overlapping needs of all of the community that we're serving?
Would it be good for us to review the master plan for the city probably before our next meeting so that we also know where the city's investing tens of millions of dollars, so that maybe if there's an opportunity to, like you said, overlap and integrate expenditures, that could be more impactful? Or is there someone that can speak to the master plan in an overview?
The master plan could take up, so much broad bandwidth. The last time the city did a 10-year master plan was 2015, so we'll be gearing up in the next year or two for the next update to that. So that's a great thing to look at and at least read the executive summary for. It's on our website. The other thing to look at is the most recent capital improvement plan. That's where you see a 6-year set of priorities across city departments, and that includes school, fire, and police, on how the city sees its investments and how to parse those out over time. So it will make sense to you as you peruse that document, how it made sense for us to use some of the ARPA monies to offset some of those costs, which then in turn was the most equitable way to share the benefit to the residents. So we didn't have to raise taxes, and we could make those across-the-board considerations.
Didn't we talk last meeting about focusing on children and families with this money? Right,
That was,
we heard that from Councilor Bagley, that was the charge of this group. And I know we talked about numbers around that, like maybe not all of it, but a majority of it. Like, I just want to make sure that people who weren't here last time heard that from him.
Well, as a way to shape that, Kathy and Will put the agenda together. So maybe that consideration gets wrapped into an agenda item for the next meeting.
Yeah.
And can I offer that if people have agenda items to email the two of you?
Mhm.
That'd be okay? Okay.
Yes, so we will wrap that into the next agenda meeting,
But, it's good not to
which we
lose
do
sight.
have scheduled for next week, 2 weeks from now on the 23rd. Do we want to move forward with this time frame for some September meeting?
Yeah, that works for me.
I'm just thinking, knowing how busy we all are, that we want to get some stuff on our calendars.
Yes.
So would the second and the fourth Tuesday work? We talked last time about, for now, we wanted to have some frequent meetings to just get things going, and then again, determine subcommittees or whatever else we might be doing.
So that would mean the 13th and the 27th.
Yes.
So we're agreeing to the second and fourth Tuesdays of next month?
I think it's a discussion item.
Yeah,
It's a discussion item.
Okay, discuss, okay.
Well, one thing we could do is, if it would be helpful, to get the 13th on the schedule, and then also make a kind of plan out at our next meeting several other dates that might work.
Also, Karen, in terms of public hearings or stakeholder meetings, how do we arrange those? I mean, at some point, we're going to have to do some of those, I'm assuming
Right,
sooner
so-
rather than later.
So the group would decide when and where you'd like to do that. We can identify a series of city facilities that can handle a production of this type, where we could allow people to Zoom, and there's enough space for people to attend in person. So if you all agreed on a cadence for that, or a number of places and times you'd want to meet, we could find them in locations that move us around the city, and so we're not just always at City Hall. We have the community campus as an option, Fire Station 2, the library. I'm sure the schools would be supportive of this as well.
Great.
We want to put that as an agenda item for next meeting, just to start to discuss.
Okay.
Will we have access to Jane's presentation on ARPA?
Yes, I'll be sending that along. And thanks for making that
Spend a little more
point.
time?
There are,
Look at the 400 pages.
Well, I just meant what she at least presented today, and then we could look at the other.
there are two folks in my office, Jessica Griffin and Joanna Deemer. They'll be the ones sending out information, so if you see an email from them, it's on behalf of the group. They're working to stand up the admin portion of this.
Great. So before we do a motion to adjourn, just to recap that we have 2 meetings scheduled, one in 2 weeks on the 23rd, and then another one on September 13th. Sean Clancy may or may not be at one of those meetings, but we'll be revisiting dates and kind of the process of where we want to go from here at the next meeting.
I just have a quick question.
Yes.
Should I email the two of you the minutes first to look at before?
Yes.
Okay.
Great.
Do you want to see them too, Karen? No.
No, thank you.
All right. Any other questions before we do a motion to adjourn? Do we have a motion to adjourn?
Motion to adjourn.
I second that.
All in favor?
Aye.
Aye. Thank you.
Thanks, everybody.